Now, our first slide here is talking about REBT, and REBT stands for Rational Emotive Behavioral Therapy. So you can see rational is for thinking, emotive for emotions, behavioral for actions, and therapy is that which promotes growth. So REBT is often considered the original cognitive behavioral therapy. And in fact, it was founded by Dr. Albert Ellis in 1955. And the reason it's considered the original therapy, he's really the first one who did this pioneering work of looking at all of the ways that our thinking affects us and how we can start to think more healthfully, feel more healthfully, and act more healthfully. So REBT encourages clients to develop rational thinking so they can have healthy expression of emotion and behavior. And just a few words on Dr. Ellis. I want to, he's obviously one of my heroes, and he lived a very contributory life. He did a lot for psychology. I just want to mention, some of the influences that he had. So initially, he was educated in the psychoanalytic school as an analyst, and went through psychoanalysis himself. And he used psychoanalysis. And in the process of using psychoanalysis, he realized that there were a lot of disadvantages to limiting himself to this modality of therapy. Even though he was effective, he was impatient, and he saw that the changes took a long time to occur. He realized that if he were more active and engaged and expressive in his therapy, and if he was teaching his clients to understand the relationship between their thinking and what they felt or what they did, that he was able to be more effective. And indeed, he was able to reach more people, which he was hopeful to found a therapy that could reach more people, be more portable, and be easier to learn and teach therapists.